Hi, thanks for joining us again. We have Dr. Jane Yip with us for a second time, and we also have one of her recent patients, Casper, and his girlfriend, Casey. Casper's going to give us sort of a brief history of his life and what led him to Dr. Yip and where things stand now. Casper, welcome.
Thanks, Mom. So I've been kind of dealing with mental health issues since I was a little kid. I was I'm just going to start with when I went to my first school. I went to my first school when I was, I think, 8 or maybe 9. I went to UCLA's mental health ward for, I was there for like 3 or 4 days. And then I went back home, and then I went to UCLA again. And then I have gone to Vista Del Mar. After Vista Del Mar, I went to a place called Heritage. I was there for 3 years, 7 months, and 20 days. After Heritage, I was home for 3 days, and then I was on a plane to League City, Texas, to go to a place called Devereaux. Um, I've kind of been in and out of mental health institutions most of my life. Um, I have been diagnosed with pretty much everything under the sun. Um, every therapist, every psychiatrist, every doctor I've ever had has given me millions of different diagnoses, and other therapists and other doctors have told me that those diagnoses were wrong. Um, I've been The only consistent ones have ever been PTSD, ADHD, and the off and on again of bipolar. Um, and basically, my whole life has been just a whole, hands thrown up in the air, confusion, not really sure what I have mentally, not really sure what's wrong with me or what's right with me. And after years and years and years and years and years of just trying to figure out what's going on in my head, my mom and I actually found Dr. Yip, and Dr. Yip was able to actually scan my brain, unlike everyone else who's just psychoanalyzing me, and give me an actual mapping of what's going on in my head. It it went from me being all these different diagnoses, all these different things all at the same time, to me having a pretty clear um, form of autism. And like, I do also have other things that doesn't discount my other mental health issues, but autism was the one that I didn't know I had, and I wish I had known. I knew that I had PTSD. I knew that I had ADHD. I knew that I had all those things, but none of them really were the answer. They were just like pieces to a puzzle. And now I have the bigger picture of the puzzle, and I kind of wish that I had known when I was younger, because I've been doing therapy and mental health stuff for, I'm going to be 30 this year, and I just found out, what, a month and a half ago, 2 months ago, something like that, that I have autism. And that means I've been doing this for pretty much 20 years without any clear sign of what I'm doing. And I finally have a more clear path to mental health help. So basically, the getting to Dr. Yip was the hardest part, because we drove. We drove from California all the way to Texas, and then all the way to Indiana. And the mapping was actually the easiest part of all of it. It was, I walked in, got to meet Dr. Yip. She was with another patient at the very beginning, so Casey and I went and got some coffee. We came right back. Literally 10 minutes after we got the coffee, I was sitting down in the office with Dr. Yip, and her and her, I don't remember his name, the other doctor.
Chris.
What?
Chris, Mr.
Chris.
Chris there. Yeah.
Yeah, Chris. He was very. They were both very kind, very easy going with me. They basically brought me into another room. It was very well lit, nice, big round table. I like round tables. We got we went in. I sat down at the table. Casey was recording, so we have all of this on video. And they put a little bit of gel in my hair, and then connected it was like a cloth, wires in it, little helmet thingy. Um, and yeah, that thing, and it was they just put it on my head. It didn't hurt at all. It was literally just like a little beanie with a strap. That was it. And I put that on, and I literally just sat there. They told me to be as calm as possible, and then eventually, after I had it was, I think, about 10-15 minutes of sitting there with that thing on my head
with your eyes closed.
With my eyes closed. After that, they told me, Chris told me to try to think of he told me like 3 different thoughts to think. It was like a really happy thought, a sad thought, and then the worst like
feeling,
the worst feeling I could think of. And it showed me, like, I got to watch this as I thought these things. It showed the difference in brainwave, brain wavelengths, and I got to see all the difference, and it was really cool. It was really simple, and after that, me and Casey went out, we grabbed some lunch, and then we came back, and Dr. Yip showed us what all that meant. There was an actual mapping of everything. She got to explain it to all of us. We have all of this, like I said, on video, and it was honestly one of the most interesting and eye-opening experiences of my life. And I wish I had been able to do it when I was younger. I honestly really do.
It would have given you a lot of clarity.
Yeah. Dr. Yip, would you sort of talk us through what you were looking for and how that looks on paper, and how we translate that into real life, how that helps, how this diagnosis protocol helps with treatment plan, and how it's applied, basically?
Yes, absolutely. So I'm going to be sending the actual results in another format. And the first thing I look for is structural connectivity. That means, are all the centers in the brain well connected? In lay terms, it means, how is the heart wiring? Did it grow properly? Did it reach the destination? Because sometimes brain growth is uneven. It did not get to the position it should. So is the heart wiring okay? And the way we do that is to compare different systems in the brain: the emotional system, attention, executive function system, the reward, self-control, and then empathy, social perception, reality perception, memory, and decision making. These are main centers that we look at in the brain, and this has been studied over decades, and different modality from electrophysiology, immunohistochemistry, which I was involved in at one point, and then some genetic studies, and of course neuroimaging studies. We know the brain network, and we know how things are connected. So the good news with Casper is that structurally he is within normal range. That means you would expect him to be able to carry out all the functions listed: emotion, reality, perception, attention, decision making, all of that. However, if once I look into the function of it, how the brain is sending out moment to moment electrical signals, because EEG is measuring electrical signals, he came short. He did not have enough electrical signal to power through all the functions. And when you look into deeper into the connectivity, he has this thing called the agnosia. So agnosia is a neurological term which means blindness, brain blindness, a kind of brain blindness. His blindness is connected with action, associative action. So I have a thought. I'm going to, I'm thirsty. I'm going to get a glass of water, and then you got to have those things associated. Where do I get water? How do I get the water? And is it appropriate? Am I in class? Do I have to wait? These are action associative function, and he does not have the connectivity with it. So he can think of a thought, but he has nothing wrong with his executive functioning. He can get things done if somebody is next to him that says, do it this way. But he cannot perceive of it and then organize the different steps and get it done. So, agnosia of perception. There are different types of agnosia. So, and then I will show you in a different presentation. And then you also have the auditory associative agnosia. That means you tell him A and he gets B. He doesn't get it completely. So, and then you also have the agnosia of social emotional, more on the understanding side, less on the carrying out. Obviously, you can see he's articulate, nothing is wrong with his language center, but the social emotional aspect. So, let's say if he's in a low mood because something happened, he may not be able to completely understand the context, the implications, the significance. So it can make social interaction difficult. And because he has normal structural connectivity, I mean, and I would call him basically normal with certain connectivity issues. So if you look at his brain activity, it's very low. It's on the blue, there's not enough activity. That's what I've asked Casper to see his psychiatrist. I'm I am not here to diagnose. I am unable to diagnose. I'm not a psychologist. I forgot to introduce myself. I have done a lot of neuroscientific studies, and I base my reading of the QEEG on the neurocircuitry, what do you call that, paradigm and angle. And so that's why I'm very much into how the circuit is connected. The way the circuit is connected, it affects his ability to associate information which is not clear cut, especially social content, social emotional content. He has difficulty putting together like Lego pieces, ideas to action. That's another difficulty. He also have multiple difficulties connected with mainly the associative part. So I would say executive function, but it's not so clear cut as in not being able to finish a task. I don't think he has problem finishing a task. He has problem going from conception of an idea to um, making the idea happen in real life. So as a result, I think structurally, I don't see anxiety. I don't see mood problems. He is stable emotionally. However, when he has to face life, when he is put under pressure, because you cannot connect. It's like you are so thirsty. You want to grab that glass of water. You see it in front of you. You know what you need to do, but you cannot quite get it. And everyone around you is saying, what's wrong with you? Just go get it. And they pressure you, or they tell you you're lazy, you're non compliant, you're a troubled kid, whatever. Because the outsiders cannot see what's happening. And the more the outsiders use pressure tactic, the more emotionally upset he gets. So as a result, over long periods of time, I do see a lot of signs of anxiety, PTSD related mood issues. And in fact, I also see something that's concerning to me, which is tendency towards delusion. Because if the real world escaped you, you cannot fit in. You don't, I mean, you understand it. It's like you're standing outside, you cannot join people. because you cannot make it happen. So where can you be but in your own head, in your own delusional world? I do see plenty of delusional signs, which is difficulty connecting with others. At the outset, it is already difficult to understand social emotional relationship, but difficulty with attachment, and it could be an early life childhood thing. Delusion in terms of guilt, there's plenty of that, and just basically having a lot of pain, emotional pain, and irritability and things like that. So at the end of the day, what you see, I think over decades of training, Casper has been practicing oppositional defiance. I can see it in his brain. Ask him to do anything, the first default setting is no, I'm not doing it. Oppositional defiance.
Yeah, pretty much.
And it's interesting because when he was, I think, 6 or 7, I took him to the Amen Clinic in California, and they saw oppositional defiant disorder on his brain scan at that age. So he's had a lot of time to develop and practice that.
It's well practiced. The circuit is very strong. I can see that on the scan. So, and now he's no longer a child. If you're defiant, you're only defiant against yourself. So, the first course of action that I suggest for Casper to do is you got to, number one, unoverwhelm yourself, because all of this is going to develop a kind of perception that it's too hard, I'm going to give up before I start. So he's got to change his mind about um, the way he approached the world when things are hard, when he couldn't quite get it. Is the time that he stopped fighting it. Stop, and in fact, the person he's fighting is not the rest of the world, but himself. Stop fighting yourself, and and also you got to be very clear what it is. I want to get my, I'm using the water analogy. This is what I want. I want to get a glass of water, but I couldn't quite get there. You need to learn to communicate, right? And figure out a way. So training each of the steps, even getting people to help him write down all the steps. That's called a task analysis. So all the steps on getting the water, and of course he's going to need pretty intensive therapy to show him how to do that. In fact, I'm going to show you, I believe I can do this on the share capacity, a virtual reality device that you can use to train your brain. So I'm actually considering purchasing it in my clinic. And what it is, I'm going to show you. Hopefully, it allows me to share the screen, which is this thing here. Now you can see that, right? Can you see that?
No.
No, you cannot see the virtual reality thing.
No.
Okay, that's unfortunate, but maybe I can do it later. So what it is that wearing this virtual reality camera, are you still with me? Yeah.
Yes.
And then it's going to stimulate your, well, you don't stimulate your brain. We don't put anything in your head, but we're able to tell you how the signals in the brain is working. So Casper does not have enough signal to make that connection. So before anything happens, the signal dies out. So he might have a fraction of a second thinking that he wants that glass of water, and then that idea just disappear. So using a virtual reality device to tell him to persist with that idea, it's going to feel uncomfortable. So we can, that's one way to do it. The other way will be to have somebody next to him and breaking it down into many steps and making him do that. So to train him on the things that matters to him. So, and look, structurally, Casper's brain is normal. So I expect him to be able to still fulfill his dream and do anything that he wants. What he really needs is support on every step of the way. So, you know, if you are to do a regular psychological testing, neuropsych testing, he would probably test short on executive function. It is not executive function dysfunction per se, it's the failure to connect the information, connectivity issue. And this is what autism is. It's a connectivity issue. The circuit does not travel long distances to complete the loop. That's why he's very frustrated, right? And he looked lazy to a lot of people because he just sit there, and he's not just sit there relaxed. He's sitting there in pain, in frustration, and just entertaining a delusional world, which is not good for him, and which I'm going to warn you against. You really need to do your best to be grounded in reality, whatever it is that you can do. So I would say it's an agnosia of association,
Yeah. And then
brain blindness
I just want to
to
quick.
associative things, learning, right?
Yeah, I just want to say to add to this real quick. I think that the best way, like in layman's terms, for everyone else that's going to be watching, um, I don't really do well when it comes to activities unless I can mirror somebody else. So like when we need to clean the apartment, I have a harder time doing it unless I see Casey doing it first. Once I see her cleaning the apartment, my brain goes, "Oh, time to clean."
Mirroring.
And then I start cleaning with her, and then I'll do it to like an almost manic level at that point, but I won't do it until I see her doing it.
Yeah,
Yes, your mirror neuron is normal. See, all your structures is normal, but you cannot come up with that perception that you have the idea,
I
but you
won't be
cannot
able to do
connect.
it myself without her to mirror.
Yes, correct. That's agnosia of perception. It's social emotional perception, it's auditory perception, it's action perception. Does that make sense?
Mm-hmm.
I've been doing a little bit, well, actually a lot of reading and research since Casper had the brain scans. And one of the things that keep coming up when I'm looking into what triggers that autism gene is maternal stress during pregnancy. And I was extremely stressed. My pregnancy was extremely stressful. And so it made sense to me that it could trigger that autism gene. My question is I know that it's possible to basically rewire the brain, but is it possible to encourage that function? Is it possible to stimulate that connectivity
Yes, yes,
deficit?
yes, of course. The more you practice something, the more it gets stimulated.
And are there exercises for a person in this situation? Are there literal brain exercises short of having, say, the VR headset that not everybody has access to?
Phone. Oh yes, it's really expensive.
Yeah.
The I can send Casper a neurological, what do you call that, practice modality. Practices working memory, set shifting, processing speed, things like that.
So I wanted to ask Casey, who has been with Casper for a few years now, has this diagnosis and clarity helped you in how you interact with him and how you guys interact together? Does this give you some kind of insight?
Absolutely. I feel like knowing a little bit more about how his brain works affects how I treat him and like go about navigating situations where we need to be productive. Um, like the whole mirroring thing. If we need to get anything done, me telling him or asking him to do it however many times and it not working has shown me that I just need to get up and start doing things to get him to be productive and to get him to do what we need to do for our day-to-day life. Um,
Another thing you can do, that's what I do with my clients in my clinic, is this thing called video modeling. So you videotape yourself or someone doing it, or he look at YouTube to see how things are done,
Mm.
and then he get it in his head. And but someone still needs to be next to him to show him each step.
Okay.
Yeah. But first of all, he has a lot of baggage to get through. His PTSD, his emotional baggage, self-image, all these things that I think that he has accumulated too.
Right. None of that happens overnight. So,
So
um,
he would need therapy to, I guess, process those emotional pain, right?
right, right. And we have connected him with a new therapist. Um, and I have actually emailed her all of the findings and the report. So I don't know if she'll reach out to you. He hasn't signed his releases with her yet, but she does have that information now
Okay,
as of yesterday.
all right, good. So I think if I do a Zoom thing and send it to her, she can look at it. Yeah.
Right.
So I mean, number one, Casper is to learn to be patient, right? Because there is a default of oppositional defiance, which is I'm not doing it. You cannot make me. So you have to overcome yourself, get yourself out of the way. Number one, right? And number two, you can still do whatever you want in life. So figure out what's important for you, and then have help to reach that goal step by step. You can plan it. You don't have to just sit there and feel like you cannot do anything. That's for sure. Don't have to feel that way. You can achieve your dreams and be the person that you want to be and fulfill the purpose that you have in your life. Isn't that the main thing in life, right? To fulfill your purpose. So to have somebody show you step by step. And then I think some brain training, I can send you some brain training. You would need medication to stimulate the brain. Again, I've suggested Vyvanse to see if that could work out for him. And one of the things that can happen with people whose connection is atypical, I would say, medication, especially psych meds, can have unexpected effects too. So uppers can be downers, downers can be uppers, or a combination of that. So medicating becomes a very tricky thing.
Oh yeah,
And the brain is
I've
already
taken
on shutdown a lot.
medication.
I, yeah, the brain is on shutdown a lot. What will not work for you are medication that kind of reduces brain activity.
Mm. What medications do that? Like sedative?
Benzodiazepine, sedatives, marijuana, alcohol, all these dampens brain activity. They're not your friend because yours is already dampened. So, you're already too chilled. You don't need to be any more chilled. You need something that activates. So, another natural zero side effects way to um, stimulate your brain is exercise. There are research there too. Exercise can help your brain grow, increases growth factors in the brain, increases the hippocampus, which is the memory center, which is what the problem is. Yeah, something that is something that activates the brain, as I said, like Vyvanse.
Yeah,
Yeah.
like I am pretty athletic. I mean, even now, even in my state where I haven't been working out for, uh, I got in my car accident in 2013. It's been about 10 years.
You're capable. You just need to
It's been
activate
about
the
10
motivation.
years since I was willing and able to work out and do stuff. I've tried a few times since then, but every time that I've tried, the people that I was doing this stuff with, like I got into a car accident at the end of 2013. It was a pretty bad one. I actually was technically pronounced dead for a minute and a half approximately during that car accident. And after that, I didn't get any physical therapy or anything like that, but I still went and literally like 3 weeks after I got out of that car accident, I had checked myself into a rehab because I was drunk during the car accident. Even though I wasn't driving, I was the passenger. And I had, a little bit of the fear of God put in me because, the car accident happened. So I checked myself into a rehab because I thought I had a problem with alcohol. And while I was there, they had a boxing instructor. And I got really excited because I was like, oh, hell yeah, I know this. This is something I know and I like. And yes, let's do it. And then I left rehab. I went to sober living while I was there, and then I left. And I stopped working out. Athleticism just didn't appeal to me anymore because doing it by myself it
Yep.
doesn't make sense.
Yep, exactly.
Like it's not that I don't want to work out, it's I don't understand working out by myself.
Mm-hmm.
Not because I need to show off for anyone. Like I know there's people that like, go to the gym and they're like, flexing and but that's never been it for me. It's always I need someone to not show me what to do, but show me to do.
Yep.
So I have a question, Dr. Yip, and well, maybe both of you can answer this. It concerns Casey, and I think it's very easy to fall into sort of the trap of focusing on the person that has the identified problem. And it's important to remember Casey is not Casper's caretaker. She's his significant other. And are there ways for people in the peripheral, in the lives of people with these deficits in their brain function to participate in helping them and whatnot, but still be treated as an equal in a relationship so that it doesn't fall into a caretaker, caretakey situation? There, in order to have a real relationship, these people need to be able to communicate on a level that works for both of them. And it puts an awful lot of pressure on her to be always having to focus on, oh, well, he doesn't think that way. It puts double pressure on her because she has to think the way she thinks and then translate that. Is there a middle ground? Is there something that they can do to work on communication that works for both of them?
Excellent question. That is the question. Yes, every time something is happening, right, with the brain, any brain-based condition is going to put pressure on families, on people around. So, and it will cause an adjustment and a readjustment. And that puts the dynamics, the healthy relation dynamics in jeopardy. And in fact, the statistic shows that separation is very high amongst people with any brain condition, not just autism, any. So special care has to be taken to preserve the relationship so that each party gets their needs met and there isn't too much one party is not taking too much or giving too much, that sort of thing. What I suggest is to go to a regular, I know they cost money, but is money worth spent, I think, to go to a relationship counselor, check in on a regular basis. And this relationship counselor must be open to understanding Casper's brain and, of course, what Casey needs as well, and be able to help them communicate with each other. So I agree. It's not Casey's job to translate his thought, to be super considerate, to show him what to do, to push him along life. No, that's not Casey's job. However, Casper needs that. So maybe I think it would be a good idea for him to get a diagnosis of autism so that he can activate services like job coaches, like the kind of service that comes to his house that helps him get going because he does have difficulty getting going, to plug him into different groups and different services which Casper needs. That's a lot that's involved, you see. So since he already has a therapist, he can go to that therapist, happy to have a dialogue with that therapist, because this is not a, what do you call that, a regular case of PTSD and working through and processing your emotions. No, this is more far reaching, affects him being able to get going in life. And if this is not done, he's going to end up being very depressed, not able to achieve anything. He will be hard on himself. It's not a good picture, right? So we need to find a way to get him going. And for Casey as well, both of them have to determine what shared values, shared mission in life that both of them can have jointly. They need to figure out what is special, what are the quality time, what kind of, because you don't want Casey to be caretaking all the time. You want to enjoy each other in a relationship. So to spell out what that looks like, and if there are misunderstanding, having a relationship counselor that helps them navigate. Right off the bat, I can see that Casper has blind spot. So if Casey is mad at him for something, he won't see it. He's
Or
not able to see
you
it.
know why.
Yeah, I would. He doesn't know why.
Right.
And the last thing you want is to chalk it up to hormone. You're having your period. That's going to drive her even more mad, right? So
I learned very quickly from a very young age not to mention that.
yep.
Thankfully,
So
thankfully I had four sisters. So
okay.
that thing, the whole you must be on your period. Ooh, no, you don't say that. You don't say that.
Exactly. So the yeah, being able to get each other, I think, is the things to work on in a for a relationship counselor. So you don't have to go every week. Maybe initially you go every 2 weeks to build up a rapport with that counselor. Talk about the things that bothers you. Talk about the things that are good, and also talk about what both of you want to achieve. Basically similar congruence, right? Similar mission helps a relationship stay together. Of course, we are different people, but we also have to have the same mission in life. That's something, if you can consolidate that, the rest are details. Of course, there are annoyance with each other, and that's normal. But if you know that you have the same mission, and you know that you both want the same thing, and that you will support each other, there will be times when you're going to grind on each other. Go back to that relationship counselor and talk it out. One thing for sure, you have to refrain from jumping to conclusion, taking things personally. That works on both sides. By the way, I'm not a relationship counselor. This is just my personal opinion. So I'm
And
sure they have better ideas than me.
I just
What
want to
do
real quick.
the go ahead.
When it comes to doing things like this, when it comes to like going and seeing therapists and going to the psychiatrist and talking to a relationship counselor and even going to the doctor for my just medical health, which I haven't done in years, I have a serious like disconnect with it. And I think that comes from, I think that's partially my PTSD. I went to these schools for so long that doctors and therapists and psychiatrists and all that kind of stuff literally scares me.
I agree.
Like
I
I
agree.
hate going to the doctor.
Yeah.
I like it takes a lot of like mental preparation to be able to go and tell a doctor like I'm having, like pain in my toe.
You can't do it by yourself.
I can't. I need somebody to physically be there with me.
Yep. That's why the right therapist, and also because there's uh, not much understanding on the brain, and I would say there's a tendency for therapists and doctors to put people in boxes. This is the box, and this is how we're going to approach it, and not seeing the more detailed nuance, right, of the individual case. Not all therapists are the same. So for example, if you go to a CBT, cognitive behavior therapist, They might just want you to see things differently and perceive things differently. But you cannot do that. It's not up to you. That is your weakest point, to perceive. One of the reasons that therapy doesn't work was because the therapist doesn't get what your problem is. So the therapists do not have this problem. I'm going to go from A to B. They have it in their mind and they think everybody can do it just by thinking of it. No, it doesn't work that way. For some people, there isn't any good connectivity. So they may want it, but you cannot. It's just like you want to go to Denver. Sure, you have that desire, but you don't know how to get there.
Does anyone have anything they want to add before we start wrapping this up? And I know we definitely want to do a follow-up to get the actual documentation or the charts with Dr. Yip, but is there anything anyone would like to add or ask?
I'm good right now.
Thank you guys so much for sharing this with us. It's really helpful.
The United States spends more per person on healthcare than other high-income countries, but still has a lower life expectancy.
We have poor outcomes relative to other countries. We pay twice as much as any other country. We pay more and get less.
My platform was built on me talking about being in therapy and dealing with narcissistic personality disorder. I don't trust people with my information because I know I use other people's information against them.
Name brand Adderall is still available for $290 with insurance. It's the generic stuff that most people can afford that's running low. You know, you have a productivity crisis with the slowdown in Adderall and whatnot. You have a literal healthcare crisis if people can't get blood pressure medication, diabetic medication.
These institutions' board of directors gets to choose who gets a liver, who deserves one, and why.
That's a common question to ask all transplant patients. Are you fundraising?
Are you saying environmental influences rewire the brain?
Whatever we do consistently will wire up the brain. Neurons that fire together wire together.
It's usually the folks that have the highest IQ who are most susceptible to developing serious mental illness. When somebody has a psychotic break, it's like a heart attack. It's like a brain attack. It takes a long time to recover from that.
They all took an oath that said, first, do no harm. I'm really fucking angry.
The policies and regulations in place by our governments place people in a position where either they're priced out, they're not allowed to do something with medical doctors, or something that they want to do is banned. So what it does is it forces people to start doing things on their own and learning things on their own. Anybody can learn to be a medical doctor.
We're taught not to see ourselves as part of a collective with a lot more power than the small group that created the system.